microbiology lab in Hospital UiTM CTC, Miss Nur Aini. Okay, so she has been giving talk, right, across the department on how to handle the nasopharyngeal swab from the moment you have taken the swab to packaging, labeling, and then transporting it over to the lab, which is at level 1, right? CTC. So this information is very important, not only for the doctor who's taking the swab, but also for all the staff nurses, PPK who will be donning and carrying the sample over to the lab. Okay.
My name is Nur Aini from Microbiology Lab. Saya harap semua orang boleh dengar saya cakap. Mungkin saya boleh turunkan mas sekejap. Alright. Okay. Firstly, sebelum proses sampling untuk ambil sampel, the first thing yang semua clinician kena tahu adalah apa yang dia nak buat. Dia nak buat SARS-CoV PCR atau nak buat RTK antigen. Sebab certain clinician yang kita encounter, diorang confused. Diorang ask test kit for PCR. Ini PCR yang ada VTM, virus transport media, yang ada cecair pink tu. Ini adalah untuk PCR. Dan satu lagi, kita ada swab yang kosong. Yang kosong ni adalah untuk RTK antigen. So jangan tertukar sebab memang ada kes tertukar dan memang mendatangkan masalah lah. Sebab untuk RTK antigen, dia punya stability dia only 4 hours. 4 jam sahaja.
Kosong,
Kosong, no VTM. Sebab for RTK antigen kita tak boleh ada VTM, tak boleh ada transport media dalam tu. So dan stability dia only 4 hours. So kalau tertukar memang akan kesian dekat patient lah. Sebab PCR ni dia boleh tahan lama, up to kalau kita simpan minus 80 memang boleh tahan sampai years. So kalau tertukar memang akan jadi masalah yang sangat besar.
At room temperature, how long will it take?
At room temperature, kalau tak ambil tak ada masalah. Untuk yang kosong macam ni, dia memang storage dia 2 to 8 ataupun room temperature tak ada masalah. Tapi kalau dah ambil, dia kena simpan 2 to 8 degree paling lama dalam masa 2 hari lah. Kalau kita nak prolongkan dia punya storage, kita kena masukkan dia minus 20 dan minus 80. Itu dia punya storage process. Sebab tu seelok-eloknya lepas ambil, terus masuk dalam ice box ni, polystyrene box, dan terus ada ice for transportation. Ice pack ni boleh ambil dekat lab micro. Memang kita provide every time datang ambil PCR punya kit, kita akan provide dengan ice pack dan juga box. So every sample yang datang, tak kira lah RTK ataupun PCR, memang should come dengan ice pack dekat dalam sekali together. Ice pack. Okay. So, lepas dah request, dekat request form dekat Unimed, dah request either PCR or RTK antigen. The first thing, dah ambil ni, dah buka semua, dah settle. Kita nak packaging dia 3 layer packaging kena ada 3 biohazard bag. So kita akan masukkan sampel tu. Ni akan selalunya sebab during proses akan ada the cleaning punya assistant kan. So the assistant will help the clinician lah. Masuk satu, and then masuk satu lagi kat dalam. And this is the last pack.
Every layer kena
seal. Yes. Tapi kalau macam glass tu, it's okay lah. Masuk di belakang sekali ni. And seal. Masukkan dalam polystyrene together with the ice. And close. Dan satu lagi benda yang kita buat adalah kena seal. Saya tak bisa detik. So kita kena seal ni dan barulah request form kena berada di atas box. Dia tak boleh ada kat dalam. Kalau request form ada kat dalam, kita akan reject sebab we're not going to open. Sebab benda ni akan di-open, dibuka di dalam biosafety cabinet. So for us, once request form dah masuk dalam, kita akan cakap dia contempt. So request form kena datang together dengan box tapi dekat atas box. Okay, untuk apa nama ni, ward ke klinik ke punya part, that's all lah. Then hantar terus ke lab, part buka semua tu checking, so that's our part lah. But before that, saya nak pesan labeling sangat penting. Sebelum ambil sampel tu, make sure label nama patient tally dengan form, sebab kita memang terima patient lain, form lain. So memang disaster juga, kita terpaksa reject. So nanti kesian dekat patient lah, kena swab balik sebab we don't know. Sebab memang banyak terjadi dapat 2 box sampel yang sama tapi request form yang lain-lain. Kita terpaksa reject dua-dua sebab kita tak tahu yang mana satu siapa punya. Sebab dia dah masuk box kan, so kita tak boleh nak differentiate. Form dia pun kita takut dia tertukar box. So dua-dua kena reject, so kesian lah. Itu yang benda yang kita selalu encounter sebenarnya. Okay. So this is the swab actually. Sangat fine, sangat halus. Swab ni sama untuk RTK dengan PCR. Boleh juga.
It is the one that you have in abundance for us to practice.
Yes.
Okay. So the practice one will be the real swab used during the swabbing. So this is small and quite long lah.
Yeah, it's quite long, so you have to patahkan kat sini. Yes. Nanti kena patahkan sini.
Oh, once taken you have to patahkan and masukkan dalam tu kan?
Okay, sure. Macam ni Okay, this is the VTM
For PCR.
for PCR. Kalau dapat yang ni, tube macam ni tapi kosong, it's all for RTK. So RTK sama ada kita bagi akan tube kosong macam ni ataupun yang panjang tadi tu. Okay. So once dah ambil sampel, dah swab tadi kan. So ni masuk dalam ni, patahkan dia.
So there's a weak angle there where you can break it. There's a breaking point lah.
Then just dia masuk dalam. So it will look like this, if you can see. Nampak tak? Okay. So that's all, and masukkan dalam bag biohazard tadi. 3 layer packaging, masukkan dalam box and together with the request form on top of the box and send it to the lab. Okay, but make sure the PPK who send the sample wear a proper PPE lah, such as a blue gown and the glove and mask. That's enough for them.
Not full.
They don't have to wear a full PPE because it's already sealed.
One sample, one box.
Yes, exactly. One sample, one box. But if you have few patients together, semuanya nak PCR, same test, boleh campur.
Okay.
Kalau macam you have 5 patient, nak ambil semua for PCR, yes, boleh campur. Tapi semua request pun tak luar lah. But untuk that case, kena lebih extra careful with the tube. Make sure every patient ada tube, ada label. Okay. Tapi kalau nak hantar RTK satu, PCR satu, same patient, sometimes one patient request for both RTK and PCR, you need to send 2 box because PCR we perform it in IMB punya lab, so different lab. So RTK we perform in the micro lab, PCR kita buat dekat IMB, so we need to differentiate the box.
I see.
Yeah.
So meaning that if a patient, just one patient, we are swabbing for RTK as well as PCR, we have 2 different boxes.
Yes, 2 different boxes.
Ice box also.
Yes, 2 different boxes, 2 different forms.
2 different boxes.
Yes, 2 different forms.
But in different places.
Yes, no, you just have to send all the sample to micro lab.
Okay.
You're the one who going to separate all those tests accordingly. Tapi make sure 2 different box. Yeah, that's very important. And make sure if you take sample for RTK, the RTK form will be on top of the box. Kalau ambil PCR punya form dekat atas. Sometimes they got mix up. And once bila kita nak buat RTK, kita tengok, oh, sample PCR. So we have to seal it back and take the other box.
So that has happened lah.
Always happen.
So how do you suggest we label the specimen, the box boxes, when do we label that?
Okay, you know what? You have a clean person together with you when you do the taking sample processing.
Clean person.
Yes. So the clean person might label the biohazard bag. You know, you have to stick the bag outside the box. Maybe you can label here RTK with the marker pen. Marker pen pun dah cukup. Okay. You might nak tampal stiker patient punya nama, just tulis RTK and the other one tulis PCR. That's enough for us to differentiate actually.
Okay.
Yeah.
And labeling has to be done by the doctor prior to seeing the patient.
Yes, sure. Especially before take the sample. Yeah.
Manual as well as attach the Unimat printer sticker.
You just have to put the printed sticker.
I mean like label this one is just this one je lah manual.
Yeah.
Okay.
Just nak tulis RTK, nak tulis
PCR.
PCR.
Okay.
Yang lain tu just guna stiker je.
Okay, okay.
Okay. Itu je sebenarnya apa yang perlu dibuat masa nak cuma yang paling penting yang saya minta sangat, which is always happen, please differentiate between PCR and RTK, PCR dengan RTK antigen. Sangat-sangat penting. Kalau tersalah ambil sampel PCR tapi minta RTK, it's okay. Kita boleh minta suruh dia request PCR. Tapi kalau nak buat PCR tapi pergi ambil RTK, kesian patient. Memanglah kita akan buat RTK tapi actually kita sebenarnya nak PCR, kita nak look for PCR kan. So as we know, PCR is lebih lagi dia punya specificity dengan sensitivity compared to RTK. So that's why please lah bear in mind, sebab sometimes kita pernah argue, dia cakap dia nak hantar for RTK tapi end up ambil buat ni.
But it's okay.
Tapi memang kita akan buat. It's okay for us to buat. Tapi dia nak reason sebab RTK kan cepat. So maybe patient tu nak masuk ke, nak masuk ward and nak do some procedures. So if you have to wait for the PCR result, it take the whole day or it's up to 72 hours, you know. So you have to wait for 72 hours. Compared to RTK just take about 1 hour for you to get the results. So ada banyak perbezaan kat situ. Dia punya daripada segi management, patient management especially. So that's why nak ambil sampel apa tu memang sangat-sangat penting to decide.
What is the procedure like normally from combat when they have box? They just go to the lab or they have to ring first?
For combat, usually every morning they will ring us first. They nak how many swab they want to take and how many boxes, ice packs and everything. But if you just have only 1 or 2 patient, you don't need to ring us. You just come to the lab, just datang, ambil, take all this kit, pergi ambil box, ambil ice. Tak ring pun tak apa, tak ada masalah. Unless you nak ambil untuk such amount yang sangat besar, so then we have to prepare the kit first. Then itu boleh call lah. Tapi if you have a patient yang suspected COVID, but you want to send a sample like CBC or other sample yang bukan untuk COVID test, I mean other profile, yang tu you have to ring us first. Kena inform lab lah kalau you nak buat CBC ke, you have to call chemical pathology and tell them this is patient investigation punya patient punya sample or this is SARI punya sample. You have to tell them first because they have to prepare themselves. They're not going to wear the PPE for the whole day. So to wait for the sample to come, so they will prepare, they will wear all the PPEs and stand by the biosafety cabinet lah to process the samples. And the other things is, if you want to send a sample other than COVID samples for CBC or for especially for biochemical punya profile, you have to put into another box. They have their own. I mean, you just use the same the other polystyrene box just for all these biochemical punya samples.
There is another box for it.
Yes, you can come to the lab and take the boxes, no problem. It's okay. But if you want to send PCR sample, biochemical test punya from PUI punya patient, also 2 different box lah maksudnya. Just like you want to send PCR, RTK and biochemical. If you work in ED, in our ED, then you will know lah, they already practice this.
PCM PG nak tanya, kalau tadi kan dia cakap kalau RTK satu box, PCR satu box, tapi kalau macam multiple patient tu kena satu box saja ke kena asingkan box dia?
Okay, kalau multiple patient tapi same test, contohnya kita ada 3 patient dan tiga-tiga nak ambil RTK at the same time, kita boleh guna satu box yang sama, tak ada masalah. Kalau dia nak ambil tiga-tiga patient nak ambil PCR pun kita boleh guna satu box yang sama untuk ketiga-tiga sampel PCR tu, tak ada masalah juga. As long as a same test, satu box yang sama will be fine.
Okay, thank you.
Maybe a PCR or yalah where the cotton leaks.
Ada. Ada
They
but
used to process.
if the VTM amount is sufficient for us, we will consider it and we will process the sample. But kalau kering terus, nothing inside, we cannot do anything lah. Yeah. But we try our best to help actually. So make sure you close the cap very tight lah. And one more thing, make sure the samples masa ambil tu tak ada blood especially untuk RTK. Kalau untuk PCR ada blood stain, kita boleh pejam mata sikit lah. Tapi kalau untuk RTK, kalau ada blood yang heavy blood stain, kalau dah sampai ke hujung, kalau dah sampai ke sini, ada ini hujung dia, sampai ke sini pun dah ada darah, yang tu kita tak boleh sebab it can cause false positive results. So sangat-sangat bahaya. So make sure kalau boleh kita minimizekan dia punya ada trauma ke kan. Untuk kalau blood stain memang kita tak boleh nak tolong, memang kita terpaksa require sampel baru, kita tak boleh proceed sebab memang happen sampel tu blood stain dan dia jadi positif. So dia akan jadi false positive dekat situ.
I see. So kalau the procedure of NPC has complication resulted in bleeding then most likely we will have to take another sample from a different site.
Yes, definitely. Okay, we try to avoid that.
InsyaAllah.
Okay, ini RTK punya kit lah, RTK antigen kit. It can come in this form or you will receive this tube without VTM for RTK, without VTM.
So it's not the length, it's actually plain tube. It can be either red or short and green without the VTM pin.
It can be green, it can be blue, it can be yellow. Any Falcon tube.
Okay. So RTK antigen is plain tube.
Yes,
without
definitely.
VTM
Without
inside.
VTM.
Okay. And they use
Sorry, buat join. Just nak tengok yang PCR tadi tu memang kita the swab stick tu kita terus masuk saja dekat dalam tu ya.
Yes.
Tapi yang RTK tu kita kena patahkan ke?
Both RTK dengan PCR, kalau datang tube ni, dua-dua kena patahkan.
Okay.
Okay.
kalau tube ni kena patah tak?
Ini tak payah, ini memang dia terbuka.
Ngam-ngam ah.
Ini memang ngam-ngam. Dia akan datang, yang kalau dia datang macam ni, dia macam ni. So ambil macam swab biasa. Masuk.
So RTK or PCR can come in this or this.
This is RTK only.
RTK only.
This is PCR. PCR can come tube panjang ni and also can come tube panjang ni.
Oh, shorter even.
The most important thing is the VTM. They should have VTM inside the tube. If they don't have VTM, mintalah yang baru.
Okay.
Request for another
leads lah.
Yes.
Yeah. Alright. Okay, that's very important. Okay, I guess it's the preparation beforehand lah to make sure that you have a patient. You also have to spend enough time to look at the kit. Label properly dulu, kiri dan kanan. Yeah.
Before the sample taken procedure, I think it's better to prepare everything first together with the request form, and then baru do the sample processing, ambil sample tu punya procedure, then baru masuk. Kita just slowly and steady. Yeah. Turnaround time. Okay. So once you hantar sample, bila result nak keluar. Sebab we had been harassing by the clinicians. Okay, untuk PCR, kita punya turnaround time di sini maksudnya bila result nak keluar. Dalam bahasa mudah, once you hantar sampel, bila lab nak keluarkan result. Untuk RTK antigen, kita punya turnaround time dia 1 jam selepas kita terima sampel. Terima sampel dekat lab. Once kita terima sampel, let's say kita terima pukul 10, pukul 11 result sepatutnya keluar. So kalau untuk kita punya in-house patient, just tengok dalam Unimed. Kita doktor contohnya hantar pukul 10. So bajet dalam pukul mungkin sampai kat lab dalam 10 suku. So dalam 11 suku, 11.30 you should boleh tengok result dalam Unimed. Tengok dalam Unimed dulu, kalau tak ada baru call lab. Okay, check dulu. Okay, itu untuk RTK, sejam turnaround time dia.
RTK if see that the sample come masa lunchtime,
Lunchtime kita akan buat.
you still processing
Yes,
masa lunchtime.
yes. Untuk RTK saja. Itu
Untuk RTK
Untuk
sahaja.
microblast kita tak ada lunch call, tapi untuk RTK kita akan buat.
Okay. So RTK insyaAllah during work time within 1 hour
Yes.
upon arrival at the lab.
Yes. Okay. For PCR ni dia prosedur dia sangat rumit. Dia punya step, lab step dia, because we have a sorting and extraction process. We have the PCR process. So every process dia punya masa tu sangat panjang sebab kita akan buat by batch, because we have to donning before we perform the test and everything, so it takes time.
Okay.
So kita punya TAT adalah 72 jam selepas terima. Itu TAT maksimum yang kita bagi. Mungkin insyaAllah kalau tak ada masalah 24 hours dia dapat result. So, tapi selepas kita terima. So sekarang ni kita punya PCR lab, dia punya running time dia every day kecuali public holiday. And Sunday pun kita plan nak buka sekarang ni. Belum lagi. Tapi for now kita running PCR lab every day kecuali public holiday and Sunday. So kita punya cut off time, maksudnya time terakhir kita terima sampel setiap hari adalah pukul 11. So kalau orang hantar sampel by pukul 8 sampai pukul 11 dalam range pagi tu, the sample will be run on the same day. We will process the sample on the same day. Tapi kalau you send sampel dalam pukul 11.30 ke atas, the sample akan pergi ke next day. So kena ingatlah yang tu. So kalau hantar sampel pukul 12, we're not going to process the sample on the same day. Dia akan pergi ke hari esoknya. So daripada situ kita boleh agak dia punya turnaround time akan jadi lagi panjang lah. Dia akan bergerak lagi hari itu. Tapi we try our best. Kalau tak ada masalah, tak ada maksudnya masalah di sini, maksudnya biasalah PCR is molecular technique. Molecular technique is very sensitive. Kalau tak ada control problems, everything problem, every day dalam masa 24 jam, usually pukul 5 ke atas result dah keluar. Kita memang akan tunggu sampai result keluar every day. So dalam pukul 5 ke atas tu dah boleh tengok dekat Unimed. Tak ada masalah. Tapi kalau mungkin bila hari tu hantar, maksudnya hantar sebelum pukul 11, sepatutnya proses pada hari yang sama. Tapi tengok result tak ada. So itu mungkin kita terpaksa rerun the sample. Ada few issues mungkin we raise. So kita kena rerun sample. So dia akan pergi ke 48 jam. Sebab tu kenapa kita bagi TAT kita 72 jam. Sebab kalau kita rerun the sample ataupun re-extract the sample, it's still up to 48 hours actually sebenarnya. So sebenarnya dia masih lagi dalam kita punya range time yang kita bagi lah.
Re-extraction, rerun tu apakah faktor-faktor lain yang menyebabkan terpaksa rerun?
Okay. First thing is untuk kita run PCR, dia ada, bila kita run, kita ada internal control. So kalau internal control for each sample tau, internal control for each sample. Kalau control sample tu tak masuk, tak jadi, so maybe we have to re-extract the sample, or either way we have to do a dilution to inhibit untuk kurangkan inhibitor yang ada dalam sampel ni. So to take the target gene, the specific gene, so there are few steps to do lah. That is our process. So it takes time sebab satu cycle PCR, complete cycle PCR, it takes about 1 hour and 45 minutes for one batch. Itu PCR mesin sahaja, itu tak termasuk extraction process yang take longer than we expect. Sebab our samples is not just from clinic, from combat as well. So jadi bila makin banyak sampel, so masa dia pun akan jadi problem, akan makin panjang lah.
So the one yang pendarahan tu is the one with RTK antigen tu. So if there is a little bit of bleeding, not a lot, we can use it for PCR. And then you can swab slowly and gently on the other side of the nose for the RTK.
PPE sangat-sangat penting. Mask, glove and blue gown sebab ada certain PPK, even ada staff nurse pun yang hantar PCR sample without glove. So saya memang dah tegur, saya terpaksa tegur. And so please make sure all the staff aware lah dengan apa yang diorang patut pakai, sebab basic things tu sangat penting sebenarnya untuk prevent ada benda yang kita tak nak jadi. Okay, that's all lah. Kalau apa-apa soalan boleh je call micro lab terus.